Today we've got Simon in with us, and he's got some lower back issues as a result of doing some work at the gym and straining his lower back. And we're going to show you an idea of how we would approach Bowen Therapy from a holistic perspective. And we believe in good assessment techniques beforehand and then reassessing after treatment, so that the client can actually see the difference straight away. So what I'm going to do is just a couple of basic assessments. Even though he's got a lower back problem, it's going to be reflected in his neck movement and his shoulder movement anyway. So we'll just show you those couple of things, and then we'll give him a treatment. So I'll just ask you to turn your head around very slowly and just stop as soon as you feel any pain or pulling or restriction. Okay, so he's going to about 80% of what he should be able to go to that way and go the other way. Just stop as soon as it feels restricted. And he's going to about 75% there of where he should be able to. A young person like this should be able to turn his neck 90 degrees with absolute ease both ways. And then with this arm, just bring it out very slowly from the side of your body and stop as soon as it feels restricted. And again, he's going to about only 80% of where it should go. It should go up and touch his ear with absolute ease if he had no restriction. And this side, just to give us an idea. And again, he's probably going 85% of the range of movement that we should sort of get. And so this tells us a lot about what's happening in the rest of his body and so on. So without doing any further assessment for now, I'll just get Simon to jump up on the table there, and we'll do some basic treatment processes just so he can give you an idea of how we work with Bowen Therapy if you're unfamiliar with it. It's unlike any other therapy. It's quite unique. And at Holistic Bowen Therapy at our school, we teach a whole range of stuff which is incorporated with Bowen Therapy to be very, very effective. So what I'm going to do is just palpate just to find out where the tension is in his body. And he's got a lot of tension down the mid part of the back and in the lower back. His glutes are quite tight. This hamstring over this side is quite tight. The calf muscles are not too bad. His neck's tight on both sides. So it's a fairly common sort of pattern of tension, and it's fairly easily resolved, typically in one treatment. So we'll just start, and we're just going to do what we call a lower back release. I just ask Simon to take a deep breath, breathe in and out, and in again and out. Okay. And that one move is extremely powerful and can actually resolve lots of issues in people. If you did nothing else, that's an amazing how much that one move is able to achieve. Take a deep breath. This is an upper back release that we do. That's it. Good. And then I'm going to go straight to his glute, because glutes are always involved in lower back issues, and most people get tension in the glutes for one reason or another. And with our form of Bowen Therapy, we address trigger points, which is what I'm doing now. There's 2 trigger points here which give referred pains down the leg. That's it. More trigger points are active in here. I can feel hard, lumpy bits under my fingers, if you like. And on this side, yep. So even though he's complaining of a lower back issue, there's a whole lot of other tension throughout his body which is contributing to this. And it's probably showing up in his lower back as a result of the types of things he does. He's an artist, so he's spending a lot of time bending forward, either at the computer or on paper, drawing and things like that, which is probably why the tension is being exacerbated in this area. So I'm just going to open up his whole spine here, take the tension out of these erector spinae muscles that go right from his head right down to his sacrum here. And this in itself would give him a massive amount of relief. Even if we didn't do anything else today, this would give him a huge amount of relief. So you can see it's a quick, easy kind of process. The work can be done through clothes, which is wonderful for a lot of people, because a lot of people don't like to get their clothes off when they're being treated, and that's not necessary with Bowen Therapy. I'm just releasing all the little stabilizer muscles down his spine here. And as soon as we're finished the treatment, which typically can take anything from 15 minutes up to, probably a worst case scenario, 3/4 of an hour or maybe even an hour, when we reassess at the end of that, there's always a significant improvement in the conditions. And then of course it takes a couple of days for the treatment to have maximum effect in the body, and so over the next couple of days things would continue to improve also. My personal experience with over 20 years of doing this work is that most people only need 1 to 2 treatments to get major results, which is pretty amazing when you compare it to most other techniques. It's only in rare cases where people have had chronic issues for a long time does somebody need more than 3 or 4 treatments. Because if you've been riddled with arthritis for 20 or 30 years, it isn't going to be addressed overnight. Okay. Good. Now I'm just going to move to his shoulder area. In the shoulder blade area, there's muscles in here. He's got trigger points which are active, which we're deactivating as we go. We focus on the fascial planes in the body from the tip of the head to the tip of the toe. All these things need to be addressed. That's why we call it a holistic approach. There's so many things to consider to make the treatment effective, but that's why we can get great results in 1 or 2 treatments. Okay, just having him lay on the table there, the angle of this leg is far greater than this one, so there's some issues with this leg not releasing and allowing that foot to come out the same as this one, so that's something we need to address. First thing I'm going to do is release the tension in his neck, because nearly everybody has neck tension as a result of things they do, particularly when they're leaning over computers or leaning forward to do anything. And yes, the right side of his neck's extremely tight compared to the left, and it'll only take minutes for this to totally release. It's almost like somebody surgically implanted a pencil in the back of his neck. Within about 2 or 3 minutes it will be really soft and that tension will be gone. It's all it takes to get rid of neck tension. A lot of people think because this is such a gentle technique that it couldn't be effective, it's not doing anything. So many people are being brought up on the concept of no pain, no gain. Well, that's not really true at all. You can achieve a lot without any real pain at all. And Bowen is testament to that. Now I'm just going to ask Simon to lift this leg with his knee straight. Just lift it up till it starts to feel restricted or really heavy. Okay. Note this angle here. Okay, just try with this one now. Okay, that one's going probably just slightly less, but both of them are very, very poor in terms of his range of movement for what he should have. So it's probably his psoas muscle, which attaches in here near his belly button and comes down onto the inside of his leg on both sides, which is probably weak. So we need to address that. And it's his psoas muscle which often affects the lower back problem. So first of all, I'm just going to address his diaphragm, just to get his breathing happening well. Just take a deep breath in and out. Good. Now, Just do a little work on his knee, quad muscles, and just going to get him to bring his leg up and address this inguinal ligament across here, which will probably be, yes, tight as, yep. We need to get some release happening in there. So there's a lot of tension in his legs, which again reflects into his lower back. Now I'm going to ask Simon just to bend this leg up and just take a deep breath and breathe out. Right. Okay, just put that leg down, bring this leg up and take a deep breath. Breathe out. Right. Okay. That's it. And all these muscles that I'm treating here at the moment are all very, very tight, which is affecting his ability to raise his legs, and it's affecting his lower back quite significantly. Now, just to give you an idea of how fast the body responds to Bowen treatments, I've only done these moves here probably 20 seconds or so ago. What I'm going to ask Simon now to do again is raise this leg up again and just see what difference there is. Okay, well that's a significant difference for a response within 20 seconds of doing the move. Bring this one up. Yeah, good. Both much better. That's good. Now by the end of the treatment, giving the body a little bit more time to respond, that would increase significantly again, and it would continue to get better and better over the next couple of days. So I'm going to ask Simon now to hang on to my arm with both these hands. I'm going to support his neck and just ask him to pull himself up into a seated position. That's it. Just swing those legs around there. That's it, and sit down there. Now just put this hand on this shoulder for me. I'm just doing a couple of moves on his back to release some tension in the upper back there, which most people get again when they're sitting at computers and so on. You get that burning sensation or pain between the shoulder blades. That's what we're getting rid of now. Again, it only takes seconds to achieve it, to get rid of it. Now, while we can't assess exactly how his lower back condition is now, because we can't show it as such, we can show probably a good improvement in the range of movement that we'd looked at before. So I'll just ask you to turn your neck around now this way and see. Yeah, that's good. It's moving further straight away. Feels easier and lighter. Yep. Okay, come this way. Ah, yes, he's going to 90 degrees now. He's going as far as we would expect him to, basically straight away. With this arm, just bring it out again slowly and bring it up. And he's got a little increase in movement. I'll do some more work there to improve that. Try this side. Okay, that one's going about probably 10 or 15 degrees more. I'll just ask you just to turn towards me here. Put your hand up here. We'll just do a couple of little moves which affect the shoulder. That's it. That's it. Yes, he's tight in here, which is why he can't move his shoulder as easily as he should be able to. Just do this side. Yeah, all these muscles are tight. You cannot have tension in one part of the body without having tension in the whole rest of the body. And that's why the holistic approach, treating all of the body, is essential to get really good results. If a therapist only treats one small part of the body, then you're not going to get the same effective results as you can get with Bowen therapy. Now I'll just ask you to try that arm again. Good. Good improvement straight away, within seconds. Again. Yeah, excellent. So in a few minutes I hope we've been able to demonstrate the effectiveness of Bowen Therapy and give you some idea of what it looks like and so on. And if you want to find out more, then certainly go to our website and check it out.